Orthostatic vital signs, or the tilt test. This is another option for assessment of hypovolemia, whether that hypovolemia is from blood loss or from other volume loss such as vomiting, diarrhea, dehydration. This is not something that's going to work for your immobilized patients, your trauma patients. So it's mostly medical patients, GI bleed, other dehydration, where you're trying to determine if IV therapy is appropriate and what rate. And this is an additional assessment tool. You'll position your patient supine and let them stay there for a minute. Some sources will say 2 minutes, 3 minutes. For our program, our consensus is going to be 1 minute. You're going to check a baseline blood pressure, both systolic and diastolic, and get a pulse rate. Leave the cuff in place, and we're going to have the same person with the same cuff checking the blood pressure again after we have the person stand. You move the patient to a standing position. Some sources want you to stop in a sitting position halfway. Our consensus is going to be have them lie supine for a minute and then stand directly and then wait 1 minute and then recheck the blood pressure and the heart rate. If the patient can't even stand for a minute, then that's a positive tilt test, which would mean signs of hypovolemia. That's not all that uncommon in these patients. Sometimes they become severely nauseated, lightheaded, and you have to be careful to get them to a supine position. But the inability to stand for a minute would indicate a positive test. Recheck their vitals. We're looking for a pulse rate increase of 20 points or a drop in the systolic blood pressure of 20 points. Either of those makes it a positive test, and that's going to be our consensus. There's some different sources out there and different places do it different ways, but for our program, 20 points in either heart rate or systolic blood pressure after a minute of standing.